Piriformis syndrome can be a real pain in the butt, quite literally. But there's a lot of confusion between the terms piriformis syndrome, sciatica, and SI joint dysfunction. And they're all interrelated things, but they're not the same thing. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what piriformis syndrome is, as well as how you can treat it if you do have it. Now, piriformis syndrome is a compression of your sciatic nerve in a muscle in your buttock called the piriformis. And the piriformis gets a really bad rap. That's because in a very small percentage of the population, 10 to 20%, the sciatic nerve pierces through the piriformis. And so it's become a scapegoat, let's say, for a lot of causes of sciatica, particularly when you have sciatica that just goes from your buttock down the leg and you don't actually have back pain. Now, in most cases, sciatica is caused by a problem in your back, where the nerve roots that make up the sciatic nerve are getting pinched and sending pain down into your buttock or down into your leg, even if you don't have back pain. So I would say if you have sciatica, assume that it's coming from your back unless you can rule that out. I've actually got another video that explains 7 different causes of sciatica that I'll link to, but for this particular video, I want to focus more on the piriformis syndrome cause of it. If we're talking about true piriformis syndrome, where it's irritating your sciatic nerve, symptoms of that are going to be sitting on hard surfaces, like a hard chair will irritate it. Standing up usually will relieve it or be more comfortable than sitting down on it. And sitting on softer surfaces or using a donut pad may be helpful. Now, some common treatments that people try for piriformis syndrome is sitting on a tennis ball underneath their piriformis or stretching their piriformis kind of like this. They may use a foam roller on it. They may get injections on it, but you don't want to keep mashing on your piriformis or stretching your piriformis. So let's think about how piriformis syndrome actually gets caused in the first place. It's usually not caused by sitting. It's likely that you've been sitting for years and years and years before the piriformis syndrome started. So why did it just now start to build up? Well, most of the time, piriformis syndrome is caused by a problem when you're standing and when you're walking. Now, why is it that it hurts more when you're sitting? Well, because after you've inflamed the sciatic nerve at your buttock and you sit on it, particularly on a hard surface like a chair, it irritates that nerve that's already become irritated. To use an analogy, imagine you went to the beach and fell asleep laying on your belly. And let's say your bum got sunburned. Well, when you go home and you sit down on a chair, it's probably going to hurt. But the problem isn't the sitting on the chair, it's that your bum is sunburned and you're sitting and putting pressure on it. So the nerves have become irritated in the skin in that example, or in the sciatic nerve in the case of piriformis syndrome. But the problem isn't actually the sitting. Now, using a donut pad or sitting on softer surfaces, or just avoiding long periods of sitting can be good in the short term to avoid provoking the problem. But how do you fix the long-term problem, which was caused by something else? Well, largely, when you have piriformis syndrome, the piriformis is in spasm. But stretching it also isn't a good idea, because a muscle spasms up because it's trying to protect itself. And you've got 2 different receptors in a muscle that regulate its tension. One is called the muscle spindle, which makes the muscle contract when it's gotten overstretched. Think of that like the knee-jerk reflex at the doctor's office, where they hit the tendon, it stretches quickly, changes length quickly, and the muscle contracts or shortens to protect that muscle from becoming injured. Now, on the opposite side of that, you've got another receptor called the Golgi tendon organ. And that receptor is responsible for sensing tension. So if a muscle gets too stiff or there's too much tension in a muscle, that Golgi tendon organ will make the muscle relax, because too much tension in a muscle can also injure it. So the muscle spindle and the Golgi tendon organ work on opposite ends of the spectrum. But if you're stretching a muscle, particularly if you're stretching it really hard that's already in spasm, all you're doing is further sensitizing that muscle spindle, which actually makes the spasm worse. So to decrease the tension in the piriformis muscle in this case, you want to put pressure on it, but not necessarily your whole body weight putting pressure on a tennis ball. There's two reasons for that. One, if you put it right in your sciatic notch where the sciatic nerve runs, you are putting pressure and kind of mashing down on that already irritated sciatic nerve, which just makes it more irritated. Even if you put it more on the ends, like by your butt bone and not quite on the sciatic notch, you're still putting a lot of pressure on that muscle, and that may be more pressure than is comfortable. And when you're in pain, your muscles also tend to spasm up. So what you need is a very gentle pressure. That may come in the form of a massage therapist or a physical therapist. You may use a massage gun lightly over that area, and just putting gentle pressure can help. But again, you don't want to mash it and beat it as hard as you can. Sometimes that good pain feels good because you think, oh, that's really getting to the right spot, but it's not really good pain, particularly in this case. So gentle pressure over the muscle can help relax that muscle by activating the Golgi tendon organ and making the muscle relax. Now, in the long term, you still have to fix the root cause of the problem, which in many cases is weak hip muscles. So when you're walking, the piriformis is a hip external rotator, meaning it turns your leg out that way. It also prevents your leg from going into internal rotation. So if you have weak hip external rotators, when you walk and take a step, your knee goes inwards and your foot pronates, this movement we call a dynamic valgus. And when you get that hip internal rotation like that, it overstretches the piriformis. And it does that probably 2, 3, 10,000 steps per day, depending on how much you walk and move around. So if you do that over a long period of time and you're repeatedly lengthening that muscle, you're sensitizing the muscle spindle. And as a result, the muscle spindle makes the muscle spasm and tighten up to protect it. So when you go to stretch it, the brute force method of just stretching it, again, just further sensitizes the muscle spindle. Even if it's a tight muscle, you don't necessarily want to overstretch it. And if the muscle's already overstretched from being repeatedly overstretched through walking, you definitely don't want to stretch it. Now, after you've done that soft tissue release by putting gentle pressure, it is okay to do gentle stretches of your piriformis, not to the point of pain, just a very gentle stretch if you have a limited range of motion. But if you can get your knee all the way down to parallel, I can't, but if you can, then you have absolutely no reason to be stretching your piriformis, even if it feels like a good stretch. But again, in the long term, you want to get the hip external rotators stronger so that you don't overpronate when you're walking or running or doing whatever other activities that you do. So how do you do that? Well, one easy way is just practicing standing on one leg, keeping your knee externally rotated, so not letting it dip in that way. If you are a runner and you've already mastered that through walking and standing, you can start to add little mini one-legged squats in while still keeping that hip external rotation. But what if your piriformis syndrome has gotten so bad that it hurts even just to put weight on that leg? Well, in that case, you can start with non-weight bearing exercises such as the clamshell, and I won't demonstrate that in this video, but I do have another video showing how to do the clamshell correctly. And I would recommend that you watch that after watching this video because many people do the clamshell wrong. It's a very common exercise, but I'd say 95% of people that I see do it wrong. So those are the things that you want to do to help relieve piriformis syndrome if you do have a true compression of the sciatic nerve at the piriformis. So those are: 1, avoid overstretching it, particularly stretching it hard. Number 2, avoid mashing on it with a tennis ball. You can put some gentle pressure, and gentle pressure either with your hands or gently using a massage gun can be helpful, but it should not be painful. And then number 3 is strengthening the hip external rotators, whether that be in standing, which eventually you have to get back to doing that. Or if it's too irritated, then you can start with non-weight bearing hip external rotator exercises like the clamshell. So hopefully you did find this helpful. If you did, give the video a like and subscribe to our channel so you can get notified of our future videos. And now I'll shoot you over to that clamshell video, or if you've already seen it, check out one of our playlists up here. Thanks for watching and have a great day.